How are you?
All right, I'm great. How are you?
Good.
Good. I
You
um
you done for the semester?
I am, and we are kind of in between terms. I always feel like it's way too much time off. When public schools they get about 10 to 14 days, and universities get a month
Yeah,
off. I'm sure there's
crazy.
a reason behind it, but it's too much, I think. Yeah, so I have to admit I haven't been as much of an avid listener of TWiV in the past few months. I wonder if how things have changed. I mean, I've looked at the titles. I actually was listening to one of your episodes today from a couple of weeks ago, and but I wanted to see how things have changed since the coronavirus has kind of declined.
I would say, um, well, first of all, at the peak, we were doing two regular TWiV episodes a week, and then the clinical update with Daniel Griffin. And now the clinical update with Daniel Griffin is continuing, and that has entirely still a COVID focus. And that's just Vincent and Daniel. But the regular TWiV meetings are back to one a week. And I would say that they are no more than half of them COVID. I'd have to look back and
Hmm.
make sure. But for a variety of reasons, I think there's just not as much. There's not as much news, not as much COVID news. It's not moving as fast. It's not nearly as dramatic. There are not a lot of the most important questions have been answered. Okay,
Hmm.
and it's sort of settling into a genuinely endemic type situation. So there's not the same kind of frenzy that we had at the peak. And so I would say, and you know, we Vincent um, uh, is we're trying to uh, sort of we gained a lot of listeners during I mean, like tenfold. We were at
Yeah.
like 10,000 regular listeners before the pandemic and 100,000 at the peak. I think that dwindled off to maybe 50,000. And I don't know what it is now, but I do know that the donations, Vincent said recently, the donations have been falling off some. The Patreon donors. Um, so people are with COVID on the, I wouldn't say decline, but on the sort of with that sort of leveling off. Uh, a lot of people who are interested just for COVID are losing interest, and we're trying to show them, sort of wean them off of COVID.
Yeah.
At the same time, showing them that there's a lot of virology out there. Some of it that's of just pure academic interest or intellectual interest, and some of it of significant health interest or environmental interest. Um, and so, we're entertaining a variety of different articles, and we've had a lot of guests. Vincent has brought on a lot of guests, and we just talk to them about what they do. So,
That's
um,
cool. I was listening to one this morning that was talking to, it was from a couple of months ago. I know it was the November because he said about the Spike t-shirts,
oh yeah,
right?
they're
Vaccinated.
yeah, they're very cool.
I ended up
Uh,
getting one as a result of that. So
Good. I've
people who are
got my Spike
listening,
T-shirt.
you did good. People who are listening, if you go to vaccinated.us/shop/ and you buy one of the shirts before the end of the year, then if you put in the coupon code Microbe TV, then the proceeds will go to Microbe TV, which produces TWiV and This Week in Microbiology and several others as well, right?
Yep.
Yeah, that's pretty cool. And you were talking to someone about misinformation also, which that seems to me like one of the things that people weren't as aware about before the COVID pandemic hit, is that just how dangerous this, conspiracy theories is one thing, but this is really also misinformation, that's that sometimes. even courts people who aren't conspiracy theorists, people who believe in the um, Wuhan Institute of Virology lab leak hypothesis. Even I heard Jon Stewart actually was promoting that a few months ago, even. And this must be kind of a maddening thing for you guys.
Yeah. I don't really, don't regard myself as an expert on the history of misinformation, but certainly I think you're correct that the pandemic. Well, it's interesting because there's a sort of a mashup of things that have happened because, of course, the political situation in this country, has been, shall we say, chaotic over the past few years, and I think a lot of the chaos is revolves around misinformation of one sort or another, and I think that the COVID pandemic did highlight misinformation to some extent, and it occurs to me that uh, one of the reasons that something like the COVID pandemic can help sort of understand misinformation is that it's by and large based on facts and science, things that are in the long run indisputable. You can dispute them, okay, and you can misinform about them, but in the end, we're talking about hard science and real facts, so that you can genuinely debunk this information. In the political sphere, that's harder to do. Okay.
Yeah.
And so I think maybe this has helped highlight the extremes of what misinformation is and what conspiracy theories are. And hopefully that enlightens some people and maybe even spills over into other realms, so that when people are thinking about stuff other than science-based issues, they can apply a newly acquired level of critical thinking to them and be aware of the fact that there is misinformation, there are conspiracy theories out there, and try and keep that in mind and do something about it.
Yeah, definitely. Well, all they have to do is look back at the hundreds of episodes that you all did over at COVID, and also it's interesting to look to the episodes beforehand because that was the years. What was it, 10 years or so that you all were doing it before that? What was it, 2009?
I think we started this in about February 2009. I wasn't there in the very beginning, but I joined within the first year. Yeah.
Yeah, they can look back at those past episodes and see that there's this large body of work. And that's what I oftentimes find frustrating with people is that they won't talk about research, really. They're just talking about these ideas that kind of came to them, and they can't even really trace back to what the source of that was. Like with the lab leak hypothesis. I mean, I was reading David Quammen's recent book on the history, right, of it, Breathless.
Yeah.
That's fascinating. I mean, they were looking at that possibility in the beginning too, even in China, right? But they were able to discard it pretty easily.
Yeah. So actually, there is. Have you seen the TWiV episode where we interviewed Quammen?
No, I was hoping that you did.
We did, and I highly recommend that. I came away from that episode thinking, I really like this guy.
Yeah.
He's he's smart. He's a good writer, but he's also just a nice guy.
Yeah.
And I really appreciated that episode.
Yeah, I had him on back in 2021.
Oh, okay.
Talking about spillover, and he was talking about his COVID book at the time.
Right.
But it took, I think, another year or so before it came out, and he was really gracious with his time. I was surprised, especially because he was probably on a deadline. But what was interesting is that, unlike his other books, he didn't have much time to go out into the actual field, right? Because it was kind of prohibitive doing that research in the field during the coronavirus outbreak, and so a lot of it was over Zoom and stuff like that.
Yeah, it's really good.
It is, definitely. So, We've had 3 interviews so far over the past, I guess it's been a couple of years now, right? Almost 2 years, because I talked to you, I think, in January or February 2021, the first time. And we were talking about the vaccines at the time, mRNA, and also we talked a lot about the history of uh, pandemics, and you're really interested in that, and I am as well. I even taught a course a couple times on that at Marshall, and I'm curious, do you have any thoughts about how COVID will be seen in its historical context in comparison to other pandemics?
Oh, that's an interesting question. Well, in relatively modern history, I think it's the biggest thing since the 1918 flu.
Yeah.
Okay.
Yeah.
And I haven't looked at the Johns Hopkins site recently, but the 1918 flu is estimated to have killed between 30 and 50 million people. This is not as dramatic as that, but of course, we're in a different age where we have more, more control over what happens. Let me see here. Ta-da. Here's the Johns Hopkins site. It says total deaths. I mean, and I don't know how accurate this count is. This is global. Total deaths, 6.7 million. That's pretty amazing when you consider that 1 million of them are in the U.S.
Yeah.
And total
Wow.
cases, 655 million. So what are there? 8 billion people? That would be less than 10%. I'm not buying it.
Sure. No, it has
You
to have
know,
been more than that. Those are just confirmed,
yeah,
right?
these are confirmed. Right.
Yeah. So it's got to be, what do you think, 4, 5, 6 times as many as that?
Oh, absolutely. I mean,
Yeah.
it's got to be easily half the population, I would think, and
Sure.
probably more.
Have you tested positive?
No, actually, that's really interesting. So I have been immunized 5 times, and we ought to probably talk about what immunization is and what the impact is
Yeah.
with a current perspective on it. So that means the original 2-shot series, the original 3rd shot, which was the first boost, and then a second boost, and then more recently the bivalent boost.
Yeah.
And I now uh, live a normal life. Okay,
Right.
I don't unless I'm in a situation where the people social situation where the people that I'm with would feel uncomfortable if I were not masked, or unless I'm in a situation where I know I'm gonna have an exposure because there's somebody. Well, I wouldn't be in that situation. I wouldn't do
Yeah.
that. Um, I don't wear a mask, and this includes, you know, traveling, airports, airplanes, Boston Bruins hockey games.
Hmm.
All right,
Yeah.
the the Boston Metro returning from a Bruins hockey game. Man, if there was ever a place to catch COVID, that would be it. And somehow I haven't caught it, and I've caught 2 other colds in the meantime. So I've been exposed to what's out there, and whether it's probably mostly the vaccinations, but there's part of me. I'm looking forward to a time when there are what we call GWAS studies, genome-wide association studies, because there's probably a certain percentage of the population that is genetically, uh, say, undisposed, uh,
Hmm.
or maybe even resistant to COVID. And I've had sufficient exposure and stuff, and never tested positive, that it makes me wonder if I'm not somewhere in that group because age-wise, I'm in a higher risk group. I'm 74 years old. I have no other risk factors, but it's probably vaccination that has kept me clean. That's the most likely explanation.
There's all kinds of gray area and factors that are involved in that too, right? Because in order for you to test positive, you have to have a certain amount of particles in your upper respiratory tract, which would also be related to your immune system, correct? So if you just got exposed to somebody and you had a bulletproof immune system from vaccination and from not being predisposed, then it's not going to test positive probably because it's not going to proliferate in your system, right?
Well, this was a discussion that we had on TWiV recently that was inspired by this very conversation where I was talking about the fact that I was feeling pretty bulletproof. And so I asked the question, is it possible, in fact? Okay, so we talk about how we don't think there's such a thing as sterilizing immunity. That is where the virus never even goes through a replication cycle in any of your cells, but is just totally taken out by your antibodies on first encounter. And, sort of by our, I mean TWiV, dogma has been that no, there's for very few infections is there sterilizing immunity, and that's unlikely, extremely unlikely in this particular case. So, but I wonder, even that is probably kind of a gray area because I wonder whether I have maybe been infected asymptomatically and never cooked up enough virus to even mount a detectable antibody response. And by that, I mean antibody to the N gene product, because I've been vaccinated so many times, you can't tell whether I've been infected by looking at spike because I've got spike antibody. Okay.
Right.
But I'm a participant in a study that goes on in Texas where they're bleeding people every few months to look at their COVID status. And I know that as recently as, I don't know, a month or two ago, I was N negative. So that by that criteria had never been infected. But in this particular episode, I posed the question, well, I wonder if it's possible that I could have been infected, but not mounted enough of an infection to actually create detectable an antibody. Okay, maybe my my immunizations, my spike antibody took care of things well enough so that even if there was some low level of infection, it wasn't enough to cook up a broader immune response, including antibody to N. And we all said, nah, that can't be. And then Daniel Griffin, who listened to the episode, sent me an article
Oh, good.
that showed that somewhere in excess of 50% of people who have asymptomatic but PCR confirmed SARS-CoV-2 infections are N negative. Okay.
Wow. Yeah.
So you can get infected, sufficient to register on a PCR test. I don't know about a rapid antigen test. I would imagine that you wouldn't be positive in a rapid antigen test because that's testing for N as well. And I would think if you have enough N to register on a rapid antigen test, you'd make antibody to it. Okay.
Right.
So, but this says that you could have a low level asymptomatic infection, enough to register positive on a PCR test, but not enough to create an antibody. So it could be I've had COVID, just don't know it and never
Yeah.
did.
I've wondered about that too, because if you get the PCR test where they go up the nose, what if you were just exposed to somebody a couple of days ago and you've got COVID particles up in your nose, but it hasn't gone because
Yeah, my guess is the PCR test isn't quite that sensitive.
Yeah,
My guess is if
that's
you're
what I was thinking.
positive on a PCR test, you're replicating virus.
Right. It's
But,
not just from somebody else's virus up in your nose.
right.
Right. Well, because you probably cleaned it out and
Yeah.
yeah, your cells are cycling and and fluids are moving and all that. Well, because I remember when we took my son, my two sons, they're twins. They were exposed to somebody who tested positive, so we were searching all over the place. This is like, I don't know, January of 2021, searching everywhere for a place that did testing, and then they did the rapid antigen testing, and I thought, well, actually, this was after they were vaccinated. So correct, it was probably around March or April, and I stopped and said, wait a minute, if they've already been vaccinated, then they might test positive, which I was wrong about that, but I was thinking they might test positive for the antigen test, but that's a different test, right? They're not testing for the spike with those rapid antigen tests. They're testing for the actual virus itself, right?
Correct.
Or
They're testing
antibodies to the virus.
No, they're actually testing for antigen. Okay. The rapid antigen test is testing for virus protein, but it's not testing for the spike protein because, as you rightly point out, well, actually, I suppose you could test for spike protein. If you're vaccinated, you'll have spike antibody. But the
right,
rapid
antibody
antigen
to the protein.
the rapid antigen test for another virus protein that's reasonably abundant called nucleocapsid. It's the protein that binds to and sort of wraps up, packages the RNA genome of the virus. So there's no possibility of entanglement with anything to do with the vaccine because the vaccine doesn't involve that gene. And it's actually looking for virus protein, so that's diagnostic of an active or at least recent, but probably more likely active virus infection. It is not as sensitive as the PCR test, which looks for viral RNA, but once again, sort of dogma or understanding is that the PCR test is almost too sensitive, okay?
Right.
And that you can have a low level of virus, so low that you might not even be contagious, but still register positive on a PCR test, in particular in the tail end of the infection. A couple of weeks down the road, you can have remnants of the virus genome and the infection lying around where you're well beyond being contagious and register positive on a PCR test. But the thinking is that the rapid antigen test, while less sensitive, it's almost less sensitive, you could say, in a good way, in that you're probably not going to register positive on that unless you're contagious. Now, I think you can probably be contagious and still not register positive in the rapid antigen test. But the thinking is that the rapid antigen test will capture the majority of individuals who might be contagious. So that works out to be a really good tool. So that if, these couple of respiratory infections that I've had recently, almost the minute I'm symptomatic, I take a rapid antigen test, and I'm put quite at ease if I'm test negative, but that's not the end of it. I'm likely to test again 24 or 48 hours later, and even another 24 or 48 hours after that, because I do know of quite a few circumstances where people are symptomatic and they test negative, and then 2 days later they test positive.
And would you, and how concerned would you be, since you've been vaccinated 5 times? I know you're 74. I'm curious what your perspective is as a virologist and as a human.
I'm not concerned.
Yeah. If you tested positive, I mean.
If I tested positive. If I tested positive, and I was, there's a bigger rap about this that I'll give you. If I tested positive, I would contact my physician and I would tell him exactly my situation and ask for a prescription of Paxlovid.
Yeah.
Okay. I would, I don't feel that that's necessarily absolutely essential. In a case like mine, I think that in a situation like mine, even without Paxlovid, given my vaccination status and despite my age, my overall health status, I would not be, I'm really not concerned at all that I'm going to wind up in the hospital or anything like that. Nevertheless, we have tools available, okay, that can help ensure that you come through this okay. And for a person of my age and et cetera, Paxlovid is one of those tools. And, it's the clinical trials on Paxlovid said that it was 85% effective in keeping people out of the hospital if taken early enough in an infection. And there's no downside. So why not? Okay. Be absolutely sure. Because this is a killer. It can
And
kill
how does
people.
Paxlovid work?
It's a combination of two small molecules that are protease inhibitors. Proteases are proteins that cleave other proteins into smaller bits.
Hmm.
And in the life cycle of coronaviruses, proteases are essential because many of the gene products are synthesized as a super long polyprotein, a lot of different proteins all hooked together. Okay. And they aren't individually active until a protease operates on that super long dude and cleaves it up into a bunch of individual proteins. And so a protease inhibitor targeting that appropriately, and I don't know the details about this particular protease inhibitor, how specific it is for coronaviruses or et cetera. But nevertheless, it is sufficiently specific to interfere with that proteolysis process and therefore interfere with the virus life cycle. There's a second protease inhibitor in this cocktail
Hmm.
that actually has the effect of enhancing the first because it actually inhibits um, a metabolic pathway in your liver that would um, uh, uh, degrade the first protease inhibitor.
Huh.
And so inhibiting that pathway has the indirect effect of elevating your blood concentrations of the directly active protease inhibitor. And importantly, conceptually, all of this dates back to HIV
Hmm.
because many of the most important anti-HIV drugs are protease inhibitors because there's proteases involved in the HIV infection as well. So nowadays, when people go looking for antivirals, um, first of all, they have a whole history of protease inhibitors on the shelf that have been tried for various viruses and for various indications that they can sift through, plus a lot of knowledge about how protease inhibitors work and what the different proteases are in different virus infections so that they can, at least dabble in designing better protease inhibitors to work on a given virus infection. So there's decades of basic science in back of this.
And that was part of my next question too. We've talked. I remember, for example, when you were describing how you heard about uh, the vaccines that they were going to be available in January. Your response was like, "Are you kidding me? This quickly? Do you just marvel?" I mean, it's are you continually just amazed at all of this? Not just the ability to devise the vaccines as well as these drugs, but to get them distributed to people in such a quick manner. When has this
Yeah.
ever happened before?
So yeah, this is the vaccine technology in particular is a paradigm shift for sure. Okay. Uh, but in some ways, uh, superficially, it looks more astonishing than it really is because,
Hmm.
and Kwame does a great job of outlining this in his book. And there are other books that are similar in this regard because it's important to understand that the field was poised to produce not just mRNA vaccines, but mRNA vaccines specific for coronaviruses
Wow.
when this broke.
Hmm.
Because a lot of the mRNA, first of all, the idea of an mRNA vaccine had been around for 30 years. And in the recent, I don't know, last decade, there have been a lot of intensive research on it and actually clinical trials going on of various mRNA vaccines, including, I believe, some against previous coronaviruses, SARS-1 and MERS. And there had been a lot of research done on what the appropriate targets were for a coronavirus vaccine, and the structure of the spike protein and how to stabilize it in an appropriate form so that a vaccine would be more effective. So that about, what was it? It was about, well, it was within 2 weeks after the, well,
genome sequence, right?
when the genome sequence was posted, they had a candidate vaccine ready to go within a couple of weeks.
Right.
Okay. And frankly, the first genome sequence was posted within just a few weeks of the first cases. People gripe about, you know, a halting response initially, but in the grander scheme of things, things went pretty quick. And whether, no matter who inspired it or whatever, and once again, Quammen does a good job of this, the release of the genomic sequence information was pretty quick. And that was critical in getting all this rolling. So that's a long rap about how, not even fortuitously, we were ready to go with this. That's the royal we. I had nothing to do with it. Okay? Nevertheless, and I think, you know what? I wasn't aware of how well prepared we were. When I made those statements, first of all, I was going on a historical record that says, you know, average time from concept or disease to vaccine is at least 5 years and more like 10 or 12, something like that. So that was the dogma. I didn't have any awareness, or really no awareness of the advances that had been made. So I didn't know how poised we actually were. But I wasn't alone. You know, a lot of very well-informed people were singing the same song as me. Like, the notion that you're going to have a vaccine in a year is crazy. All right. And I looked at that as just as hype. But it could be that the people who were hyping it were actually talking to the individuals who could put a reasonable timeline on this and said, yeah, we could have a vaccine ready and a clinical trial done within a year. All right. So yeah, it seemed crazy, and in terms of distribution, I think we probably could have done better. I think one of the lessons from all of this is that the whole public health system and response, healthcare system in general in the U.S. needs a lot of work, and public health in particular needs a lot of work. There are large swaths of the population who don't have appropriate access to health care. I think that the ability to distribute information and therapies to the whole population, let's get everybody, is not what it should be. That having been said, we did do a good job.
Sure, and of course, you talk about other countries, especially places like Africa and places that don't have as much public health or access to these services. The distribution has been lower there, and Daniel Griffin's brought that up many times too.
So it occurs to me, I don't know that this is true. This is an opinion, but based on what I do know, I wonder if the biggest problem in getting everybody vaccinated was not the distribution of the vaccine, but people's willingness to take it. Okay, and that circles back to your thing about misinformation. It circles back to just having an informed public that can um, that has critical thinking skills. Those are all important things.
Well, that reminds me too. 2 years ago, when I first thought of doing a podcast, it was going to be about COVID in West Virginia, and the reason was because there were two different types of data sets out there about our state. One was that we had, and this wasn't being advertised, but one was that we actually had the highest new COVID case rate in the country for just a couple of weeks or so, at a very high rate, though. And sometimes that's because there's a flood of reporting that happens all of a sudden, and then it has to kind of even out, because within a couple of weeks that kind of ironed itself out. But it was really high, twice as high as the next state. And then we also had this thing that was saying, the stories that were saying that we had the highest vaccination rates, the best distribution rates in the country. And so I called around to different news stations and newspapers around the state and said, why isn't anybody covering this kind of, this duality here, this contrast? And I thought, well, okay, I'll just do it myself. And we were getting all this great press. The state was getting all this great press about distributing it faster than everybody else. We were using small pharmacies. It was all about because people know each other in the state, kind of like a big, family. And then if you look at it 2 years later, we have some of the highest per capita death rates in the country. So and some of the lowest vaccination rates overall.
Okay.
And so the long run has a lot to do with, probably the politics and the culture and all that too.
Yeah. But there's, looking back on this, I think the single most important issue is vaccination. Because, it's complicated. It's almost hard to remember shutdowns, and what that was like. And it's hard to appreciate how much was unknown and how much we were trying to learn on the fly. But in retrospect, kind of what happened was we figured out pretty quickly that this was pretty contagious, that it spread asymptomatically, and that in particular in certain populations, it was a killer. Hospitals were genuinely being overwhelmed. Okay. So it was a genuine public health crisis. And at the time, we had no appropriate therapies. And so I think that given our understanding of how it was spread, our limited understanding, but somewhat understanding of how it was spread, that shutdowns were an appropriate response and an appropriate thing to do. The appropriate thing to do is to be able to, while you are shut down, get the vaccines developed and deployed so that you can vaccinate everybody and then open up in that environment. Well, it was not straightforward. That's kind of what happened.
Mm-hmm.
But in the end, ultimately, the vaccines are absolutely the most important thing out there. And I will bet you, I'm not an absolute authority on this stuff, but from what I know, if you have a look, the vast majority of deaths that occurred could have been prevented by vaccination.
Yeah.
Okay. And so it's not really a failing of policy with respect to shutdown. It's not really a failure of science or healthcare when it comes to developing and distributing a vaccine. It's a failure of education and a failure of politics that results in the vaccine hesitancy, the unwillingness to get the vaccine that causes mortality that shouldn't have happened. There's probably also an important component of a failure of the healthcare system in reaching certain minority populations. Okay.
Yeah.
And that's an aspect of public health that going forward we really need to deal with. We really need to have equitable and accessible healthcare for everybody, right? So that when this kind of thing happens, well, just in everyday life, people can have access to healthcare and stay healthy. That's good for everybody. But in particular, in a situation like this, when there's some sort of public health emergency, that we can respond better and reach everybody.
Right. There's other aspects of this that are intertwined that became kind of part of the public discussion, which is that public health is not just about choices. It also has to do with socioeconomic status.
Yep.
And socioeconomic status oftentimes is also tied in with politics and culture too.
Sure.
And how to concretely define those is really difficult, because we certainly saw a lot of people who were obese. And I'm very interested in health and nutrition systems, especially food systems. Spoke to a doctor a couple times up in northern West Virginia, Dr. Cucuzella, who was bringing up all kinds of articles that were associating poverty, obesity, and negative outcomes associated with COVID. And oftentimes you realize that it's not always about choice, but it oftentimes has to do with where you were born and what your background is, because you might be less educated, but it also might be that you have a food swamp or a food desert around you, which makes your immune system less able to deal with it, and so all those things they kind of stack up against some people, and then they stack up in favor of others.
Yep, absolutely. When I was thinking about this, and this goes back to what you were asking earlier about how I feel about the possibility of getting COVID or whatever. To a very large extent, I'm privileged.
Yeah.
Okay, because I have health insurance. I have a physician I can contact. I know exactly where to go. I'm confident in that person. I'm confident in my information. I'm confident that I know what to do. And there are large swaths of our population for whom none of those things are true. They
Yeah.
don't have health insurance. They don't have a doctor they can go to. They don't have the right information. And it's not their fault.
Right.
Okay. It's a fault of us to actually reach out and make sure that those people are included.
Yeah, good point. Yeah, the idea of fault is oftentimes it comes into the discussion. I've heard it many times and even had thoughts about it. So go, why would those people think that way? It's like, but then you say, well, wait, there are actually historical explanations for this, and that's why I love studying history and combining it with science too. To kind of go back to another question I asked about how you would look at COVID historically. I put a spin on it in my classes sometimes that might, I don't know what you would think about this, but I say, look, even though we lost 1 million people in the country, by comparison to the Spanish flu, which may have had some kind of a similar lethality of 1%, although that's going to be difficult to parse, obviously, at least the president actually did do something. I'm not in favor of Trump, right? But he did dedicate a ton of money to the research for the vaccines, and he put out misinformation himself. But Wilson did nothing. Wilson said for the Spanish flu, he said, "Hey, we can't have people demoralized about this because we have to finish the war." And that actually makes sense too, if we understand it from his perspective, right? The burdens that he was under. But by comparison, I think we might have done better than any other pandemic, that big one, at least, that we've dealt with in the past.
I think there's a lot of truth to that. I think that one of the reasons that this may only be 20% what that flu pandemic was is because of all of the things that have happened in the meantime. I mean, when the flu pandemic happened, we didn't even know any virology. We didn't know it was a virus. We didn't know what flu was. Okay.
Yeah.
At the time, I guess vaccinology was in its infancy, but certainly not advanced enough so that they could come up with a vaccine. And I mean, they didn't know that influenza was a virus until well after that pandemic was over. As a matter of fact, they thought it was a bacterium, if any, or that was one of the leading theories. We didn't have the same level of communication. So we couldn't reach people in the same way. There was a war going on, which did complicate things. But, all of the advances in technology that includes not only healthcare technology, but communication technology helped, in a relative sense, nip this thing in the bud. It's horrifying to think what would happen if we didn't have all that stuff.
Absolutely. Yeah, I mean, that's what Steven Pinker does a good job of kind of looking at the relative harms that have happened over time. Because a lot of the discussion, especially from progressives during the coronavirus, was like people were just incensed that people weren't wearing masks, so they weren't getting the vaccine. And I was a little bit, but I was more thinking in terms of, well, we can't be perfect. We've never been perfect in the past. We're better now. That's what I was happy with.
Yeah,
We're better now, and we're going to be better, hopefully, for the next one. And that's really all we can expect.
I think
Wars will
that's right.
still happen, right?
I
Uh,
agree.
yeah. Um, and I'm curious what you think about. Are there any? I'm not asking you to predict the future by any means, but you have your pulse more on the literature, scientific literature of what's happening now, because as Quammen points out in his book, there's like 1,400 known pathogens that affect humans, and about 70% of them are spillovers for zoonoses. So there's always something that is potentially coming from nature that can inflict itself upon us. You see anything on the horizon?
Uh, in thinking about this, I think about what we've seen in the past decade. We've seen three different coronavirus spillovers.
Mm,
Um, SARS-1, MERS, and SARS-2. Uh, Seen monkeypox, which I didn't expect. We've
hmm
seen one flu pandemic, and of course, there's the annual variation in flu. Zika virus. Does anybody even think about that anymore? That swept the globe so quickly. Um, and Ebola. That was pretty localized, but nevertheless, it was a pretty nasty outbreak in Africa.
hmm
Um, Interestingly, you think about those. Well, the only ones that were really, really raging global pandemics were Zika, the coronavirus infections, and flu. And of those, the coronavirus infections were probably the nastiest. So, like you say, I was looking up and thinking about
Yeah,
this today. Uh, Niels Bohr, believe it or not, says predictions are difficult, especially when they're out about the future.
sure. Yeah, yeah.
uh, I think coronaviruses have to loom. I think corona and flu are the most obvious ones. They've been the most global, the most frequent, the most damaging over the past decades. There are others out there. There are Nipah and Hendra
Mm, nasty.
and Ebola and Zika and all those. But the ones that have really been a problem are the coronaviruses and influenza. But I think it's really important. So I think it's really difficult to try and anticipate what's going to
Yeah,
happen. But I think it's really important to be monitoring the animal population for these and other candidates all the time, and also to be developing tools to do, uh, sero surveys in humans. I think an important question is how frequently do any of these infect humans and we don't even know about it? Okay.
yeah.
Um, so the sort of interface between the animal world and the human world is important to explore. What viruses are out there? To what extent have they spilled over in the past and we're unaware? What's their historically their potential for spillover? Um, Tough problem.
Yeah.
But I think at the same time, the public health that we've been talking about is every bit as important an issue, and maybe even more important. Okay, because I think it's very difficult to predict and be prepared for what's out there. Okay, but if there's basic science like the mRNA technology and other vaccine technologies that are prepared to take up whatever comes along, and if there's public health preparedness that will assist with even the basics like having enough PPE and hospital beds and communication and methods to disseminate all the supplies and the proper information. Then when the next spillover happens, and it will, we can be better prepared.
And just going through the, go ahead.
I was just thinking, I think it's also important to understand that the mRNA vaccines are not necessarily a panacea. In some respects, we got lucky with this because it turns out that this particular virus is very susceptible to a vaccine against a single protein that was easy to identify as an appropriate target. And that doesn't have to be the case, okay? You could have another pathogen come along and the whatever target you might make a vaccine for might not be as obvious or might not work as well, or the virus may be able to evade more. So it doesn't have to be, monkeypox is a good example. People say, well, why don't you just make a vaccine against monkeypox? No, you're talking about a dozen different proteins at least. That would be important. You can't identify some single target and make an mRNA vaccine. So the appropriate scientific or health response is going to be pathogen specific. All right, it's not going to be the same answer every time.
That's incredible because like in our conversations and in my readings and listening to TWiV too, you get the sense that there is a lot of specificity in here, whereas my brain, at least the way my brain works, is I want to see some kind of a consistency in here so that I can have predictability, right? I'm looking for patterns. And so, if you look at smallpox, high lethality rate, right? High rate of transmission, but then it was able to be closed down because it didn't mutate and it doesn't exist anymore in nature, right? That's part of the reason, but also the vaccination effort was widespread. Okay, so that's kind of its own thing. It's not the same as HIV, which has this high lethality rate too, because HIV almost acts like it lurks. You don't see symptoms, and so you spread it, even if you have symptoms, kind of like what happens with COVID. You can be asymptomatic and you're spreading it around, but the two are totally different because one has nearly 100% lethality and the other one doesn't. And then you have SARS, the first one, and MERS, which had really high lethality rates, but people aren't spreading it when they're asymptomatic usually, right? It usually waits until they're actually symptomatic. And that was self-selecting in a way because then they usually would be in bed, not spreading it around. So that, and measles, there's all these different things. And so what's going to happen next? It could be a Hendra type thing that's just awful, or Ebola hemorrhagic, and then it could spread asymptomatically too, right? There could be these combinations that we're just not anticipating.
Yeah, you got all of that right. And it makes the point that it's really a case-by-case situation.
Yeah.
If there's any message from TWiV, it's that the world of virology has enormous variety in it. Okay, and so every story is different in terms of how the virus works and if it's going to cause a problem, what to do about it. Okay, And so you have to have a really open mind, but and be able to consider all the different possibilities. However, if you have that kind of approach, there are lessons out there in each of the situations that we've dealt with that can be brought to bear on a new problem and say, well, does this apply? Does this apply? Does this apply?
Mm-hmm.
So we have a body of knowledge that will help narrow the possibilities for treating a new spillover at any given time. But you're right.
That makes sense.
Every problem is different. There's no unique solution.
Well, and as you say, there are our past knowledge can help us to address the new ones coming up. At the very least, we can talk about quarantines, PPEs, looking for some type of sequencing the genome so we can address it specifically, testing as well. All these non-invasive things that we can do in the meantime, that can apply to everything, right? Even a bacterial infection. Uh, but then to know, and so that aspect of it, on the microbiological level, is important. But then you also have this, uh, what to do, how long to keep people isolated, and how much of the population should be isolated. There's a school of thought that I've heard that has, well, more the conservative side, that says, well, let's look at the demographic of people that are actually that are more susceptible to dying, and then isolate them more as opposed to isolating everybody, like the kids. Because schooling, for example, could be affected by this. What are your thoughts on that?
My thoughts are that this is probably the most complex and controversial part of the whole problem. I don't have a clear answer on this. Okay, because on the one hand, you want my knee-jerk reaction, and the knee-jerk reaction on the part of a lot of public health people, I think, is to err on the side of saving lives. Okay, which is to absolutely do everything you can in the absence of other treatments like vaccination or drug treatments to keep people safe from the infection. And so you shut down pretty tight for until you have evidence that it's safe to open back up again. But I think one of the things that we learned during this whole thing is that there's a social cost for that.
Yeah.
That is both an economic cost and a mental health cost. And the economic cost is, talking about people being able to make a living. And so finding the right balance there, I don't have a clear answer. Once again, it's going to be case by case, and
Right.
I don't even know if we found the right balance. Too many people died. I think we could have saved a lot of lives. But is that because we didn't close down long enough? Or is that because the vaccine uptake was poorer than it should have been? Okay. Or not as quick as it should have been? I personally don't have an answer to that. I think the vaccine has a lot to do with it. Okay. I think, not necessarily scientifically, but socially, we could have done a better job of getting people on board to get vaccinated and saved a lot of lives. Okay. And been able to get about our business quicker. I think the vaccine resistance was a huge problem in this.
It's interesting too, because there are these aspects of fallout, especially on some kids that were isolated, but even people who, older people, or just people who were, single, who couldn't interact with other people. There's a mental health impact there that's going to be, it's difficult to measure. On the other hand, you had people who could possibly come together more. Like, you actually got to homeschool your grandkids a little bit, right?
Yeah, that's right. Right. I mean, it had on my immediate family, it had very little impact. Okay. But once again, I'm privileged. I'm retired. My children can do all of their business remote. My grandchildren had good internet access, and schools that were good enough to be able to provide online education. So those are all privileged circumstances. Okay. And there are large swaths of the population who don't have any of those advantages. Okay. It's a really tough call.
Yeah.
I wonder, and of course you can't do the controls. You can't
Yeah.
you can't go back and do it over again. I wonder what it would have been like, what the sort of overall disease burden and mortality would have been like if we had not shut down as long or as thoroughly as we did, or if we had done more. I don't know. I don't have an answer to that. It's a really tough problem. I think that's
Sure, because
probably the most complex part of this whole thing is
right.
the social response, in particular with respect to shutdowns. That's a tough one.
Yeah, because if we go back to March 13th, that's my memory of when we shut down as a
Yep.
nation. I know because we got a dog 7 days before that, and we've had, he's kind of our COVID dog. We were lucky we got him when we did. But then, we weren't thinking this is going to last for months and months afterwards, and it certainly wasn't going to be this piecemeal undoing of the lockdown. We thought, well, it's going to lock down until we understand this better, and then we'll be able to open up eventually. But then it kind of dragged on in some places, and other places they opened up. I imagine some kind of a combination of kids being able to go back to school, but wearing masks and just making sure that they're not interacting with the people who are susceptible. But then in the school grounds itself, that's where you have the problem, because the people who are susceptible are the teachers and the staff and the administrators. They don't want to get sick necessarily either, and and how do you isolate kids from adults when they come home either? That's obviously a difficulty.
So you'd have to check me on this, but my recollection is that in many areas, at least, and I think that includes this area, that the schools pretty much opened up with precautions in hand, like distancing and masking, before the school age population was vaccinated.
Yeah,
Okay.
yeah,
And I believe that the analysis of that is yeah, I remember discussing this, that there was very little spread associated with the school circumstance itself
yeah,
under those circumstances. And what spread there was had to do with social activities around the school, okay? Because by opening up and putting people back together, people would socialize outside of the school circumstance, and there was some spread there. So I think it is probably true that we learned enough in the early stages of the lockdown to develop concepts like masking and distancing that could be applied effectively in this particular circumstance in something like schools. And maybe we would have been able to apply that more effectively in the community at large in other social circumstances as well. I don't know. But I don't know. Maybe those are all lessons that can be applied another time.
yeah. People have to be willing to understand this spillover concept. I think is that it's not just that they don't believe that it came deliberately from a lab, but also because it's not just about respiratory viruses. It's about respiratory bacteria. It's about sexually transmitted diseases. It's about fungal infections. We interact with nature, not just animals, obviously, but we're interacting with nature, and we can't just walk along without consequences, especially when there's 8 billion of us and growing.
Yep.
There's going to be more of these, and factory farming and hunting and all that we're involved in. We're constantly interacting with these microbes. So, well, it's been really great listening to you guys over these past couple of years. I hope that, and I know a lot of people have learned a lot from listening to you all. You get to interview people from around the world as well. It's all facilitated through the internet, through yeah. And look forward to listening to more things. Is there anything else you wanted to add before we sign off?
No, I think I'm looking over a list I made in response to your proposed questions, and I think we've pretty much covered the whole thing. So I would emphasize that I don't know. I think the healthcare system in the U.S., healthcare system in general and public health in particular, I think we've, if we're smart, we've exposed weak points in that need to be addressed. I mean, we've known about a lot of this for a long time, but this really really revealed how vulnerable it makes us to something like a spillover. And we really need to pay attention to effectively reaching the whole population with appropriate health care. That's really important. And I think your opening discussion about misinformation is really important as well. And I think that's never going to go away. What we can do is do whatever we can to help people think on their own and be able to dissect truth from misinformation. And in my mind, that comes back to K through 12 education. I think probably K through 12 education ought to be the most respected and the most rewarded discipline in our society. Okay, because that's where potentially we teach people how to think. Okay, and not just you don't and the approach has to be you don't tell people what they should know, you tell people how to know it. Okay, so that anytime they encounter anything, they ask, knee-jerk reaction is that true? And to try and figure out whether it's true, they know where the resources are, and they know what the reliable resources are, and that sort of critical thinking capability is taught at a young age, and it has to be taught over a long period of time. So my bottom line would be that we really need to focus on the kids, focus on K through 12 education, and hope that eventually that translates into a fairer, more equitable society for everybody.
I really like that a lot. Kind of follow like Finland. They that's where they focus. And they even have less education than we do, less years of public education. It's like 7 through 17, but their best students get scholarships to be teachers and they get really high pay too. And it makes a lot of sense. Focus on from the beginning. Yeah. Well, great talking to you as always.
Great talking to you, Chris. I really enjoyed these conversations.
Thanks so much. Yeah, me too. I'll be in touch again soon. I'll keep listening to TWiV too.
Sure enough. See you then.
Thanks. Take care.
Bye.
Bye.